The world is still in a pandemic mode. COVID-19 is dictating the way we work and play. Even the arrival of vaccines has not given enough assurance for life to return to what used to be normal. In Nigeria, issues on the strength of the health sector, welfare of the personnel, and even perception of some Nigerians on the existence. Yes, almost a year after the first case in the country, some still believe that COVID-19 is a scam. So special reports will touch on these issues on this episode. You're welcome. I'm Ini John Mekwa.
I was fortunate to have had a relatively moderate COVID-19 experience. About 1 in every 10 who contact the disease in Lagos is not so lucky. They have to go into intensive care, and some, they do not make it out of life.
This was the 24th of December 2020 when Governor Babajide Sanwo-Olu of Lagos State had his first interaction with journalists after spending 2 weeks in isolation because he tested positive to COVID-19. Some of those he refers to who have lost their life in Lagos are Professor Ibidapo Obe, former Vice-Chancellor of the University of Lagos. Also from the University of Lagos, Professor Duro Ajayalemi. Then there's motivational speaker Ubon King and a brother to the Deputy Governor, 37-year-old Dr. Harun Hamzat, who worked in one of the public health centers in Orile, Agege Local Council Development Area. The chairman of Amuwo-Odofin Ojo Zone of the Association of Private and General Medical Practitioners of Nigeria, Dr. Innocent Okwawo, he says as a family physician, they've recorded losses.
We had a gynecologist who went to operate on, for a C-section for a woman who was COVID-19 positive. Of course, then the whole idea was go there, save the baby, save the mother, but he didn't realize that he needed to put on extra protective gear. He got infected and died. So it's real. It's real to us. We several colleagues we know have died from COVID-19. So it's real to us. So right now, it's affected the way our usual training is to see a sick person and rush to want to assist. But now we recognize that you have to self-preserve yourself. You have to self-preserve. You have to think of how much protection do I need to wear to interact with patients. So currently, no interaction between patients takes place in our hospitals without at least the basic level 1 protective gear, which is face mask, face shield.
Sad losses which should not be allowed to continue, which is why another survivor, stand-up comedian Ali Baba, took to social media to warn Nigerians and ask them to be conscious of COVID-19.
COVID is real. And my sympathy goes to all who have lost loved ones within the period that this COVID had come to Nigeria. Now, please be aware, the next wave of COVID that is around now is deadlier than this strain of COVID is deadlier than the one that had come before because it's mutated. The people that are going about carrying on like they don't have COVID or have not gone to be tested have COVID. They are symptomatic and they will spread it to you.
In August, when the number of fatalities surpassed 1,000 and daily cases were in the range of 500, it seemed guards were lowered. But with the second wave, which was officially announced by the Presidential Task Force in December 2020, daily cases now surpass 1,000. Total infection now in the range of 100,000 and total deaths is nearing 1,500. The disregard for protocols climaxed during the festivities, and unfortunately, even the high figures have not led to more compliance to safety protocols.
I'm afraid of COVID-19. And the Lord will protect us. We will not see COVID-19.
The issue here is, first of all, citizens don't trust the government and the governmental agencies that are giving them information on what to do. And the implication is you can't control it.
Medical practitioner Ijoma Onwekre says that there are other ways which the government may be able to convince more Nigerians to believe in the existence and dangers of COVID-19.
Over here, they show you actual patients, show you patients battling with COVID, show you like the procedure, like what they have to do, how they self-isolate, how some people died, how some people are on the sick beds. They show you everything. But in Nigeria, they're showing you figures. That doesn't help. They have to go to these facilities, they have to go there and show people that this is real. And people that survived COVID, they have to actually come out and say, I had this was my experience. They have to come out and speak up, not just to prevent the next person, but let people know that this is real and it's serious. Aside that, I always hear this issue of people saying stuff like COVID is not in Nigeria, the sun is going to help, kill the sickness or whatever. That's not true. I'm in America. I could travel to Nigeria and don't have COVID symptoms and everything, or not have COVID. And when I get to Nigeria, I could give it to you. That's me coming. COVID is not like a person. It's not like something, it's being carried from one person to another, So saying there's no COVID in Nigeria or trying to look for some sympathy is not true. It's not true at all. COVID is real. I've dealt with COVID patients. I've been at work. I've almost passed out taking care of a patient because now I'm thinking, oh, I have to, try to make money to, survive. And I'm thinking about my health. I'm thinking about, oh, I'm the only girl in the family. How would I survive? How would I have to think about all this. I have to go into the facility, going for checkups like twice in a week before I could actually work, So it is real and people have to take it more serious.
The message of prevention is, among other things, driven by the fear of the possible inability of the Nigerian healthcare system to handle higher figures than presently recorded. The state of the primary healthcare system, which should be the first contact with patients, has been a source of worry. A case study on Nigeria's healthcare system, supported by the World Health Organization for 2015, shows that whilst the national average for doctors per 100,000 population is estimated at 12, some zones, notably Northwest and Northeast, have as low as 4, whereas the national ratio of nurses and midwives to 100,000 population stands at 21. The Southwest, Northwest, and Northeast zones have 16, 11, and 18 respectively. Doctors, nurses, and midwives are more available in non-PHC healthcare centers. The chairperson of Lagos State Council of the National Association of Nigerian Nurses and Midwives, Comrade Blessing Israel, does not operate in a PHC, but even in the urban centers, there are personal complaints.
The new wave of COVID is ravaging the health workers. A lot of health workers, nurses, doctors are being infected with COVID this period. And we know that this new wave is virulent and is very, very serious, unlike the other wave that we have experienced previously. And we all know that actually there's brain drain in healthcare system. A lot of nurses and other health workers are leaving the system, leaving Nigeria to other countries, just because they believe they have better opportunity over there, better remuneration, better conducive environment to practice. And I think the government need to do a lot for us. And the hazard allowance, I think we don't have to negotiate that. The 5,000 naira across board as other hazard allowance to health workers, doctors, nurses, laboratory scientists, and others is so bad, it's so poor. Something needs to be done. We don't need to negotiate that. Government should see what we are doing and see the need, urgent need for this to be increased so as to motivate us. It doesn't matter the risks you are taking, the number of hours you put in, the number of the level of exposure to disease, the same 5,000 naira to every health workers, which I think this need to be addressed as quickly as possible.
The availability of personal protective equipment has been another challenge in fighting COVID-19. In June 2020, resident doctors went on strike to protest, among other things, inadequate PPEs. In December, 20 healthcare workers had died in 1 week after exposure to coronavirus.
There are a lot of health workers are being infected because many patients that come into the hospitals are not being tested for COVID. So you can't really ascertain whose patient has this disease. And at the same time, the PPE the health workers are using are not enough, are not adequate. The health workers are trying, nurses are trying, making use of the PPE judiciously, but they are not adequate in the system. Of course, if you are dealing with a patient or patients with COVID, of course you should be able to use N95 face masks, which is not really available at this time. And I think at this time, at this critical period of this second wave, we will know that the strain is more virulent compared to the first wave of COVID. The government, our medical directors, heads of hospitals need to, all hands must be on deck to ensure that these personal protective equipment are available and they are used adequately.
Let's be global in our thoughts, really. PPE is in high demand globally. And so if we would expect shortages globally, because I'll give you, I remember that when the COVID-19 crisis started in January 2020, I told myself that those who manufacture for the world have COVID-19. The factories have shut down. It means we're going to have shortages of virtually everything down the line. That was even before it got to Nigeria or it got to other parts of the world. So let's recognize that at the beginning of the crisis, there were no factories manufacturing. So it was only those who had a stockpile of it that had enough. Now there is a global need for it. So it means that the factories will have to increase their production and the like. Yes, there is shortage of personal protective equipment. There is. In the private sector, what some of us have done is to pass the buck to the patient. So if a full protective gear will cost maybe 5,000 or 7,000 or 25,000, whatever the cost of the protective gear, it is passed on to the patient. So if my interaction with you would normally have cost you 5,000 naira, and I need to wear protective gear of 5,000 naira, it means that our interaction will now cost 10,000 naira. It's pretty straightforward. So some of us have tried that, but you can't always pass the burden to the next person. Sometimes the patient comes, it doesn't even have money. What do? Well, we will do what we can and then hope that the patient can pay.
In July 2020, the United Kingdom announced a new health and care visa policy to attract the best talent in Nigeria and other parts of the world. This was after the UK had stopped issuance of visa following the outbreak of COVID-19. The migration window was for care professionals, social workers and their families to bolster its national health service. Many professionals from Nigeria responded, and after several attempts to stop them, they eventually relocated.
Okay, so during the COVID, the COVID season, like when it was really intense, like I said, a lot of my fellow healthcare worker, they quit their jobs. They try to make sure they don't have it, just because just the government is always there to support them. But the pay was good. When I say the pay was good, if they pay you like 30K a month, for example, they could say, okay, we're going to pay you 100K a month. Come work. You'll go to work.
In the UK, if you're working in a hospital, when you go to theatres, each theatre, there might be 10 theatres in a hospital. Each theatre is kitted out with all the equipment that's needed. They will have all of the scalpels, all of the disinfected, equipment that is needed to use for that particular theatre room. Whereas when I was in Nigeria back in 2011, there was an issue in terms of how many operations could occur at one time, because the hospital was lacking some critical equipment. So even though they had the doctors, the nurses, the anaesthetists, the surgeons all ready to operate in 2 different operating rooms, only one operating room could function at a time because they were lacking in some critical equipment. And that was quite disappointing, because you have these health professionals ready to go, you have these patients ready for their surgery, but things were delayed due to lack of equipment. So that is one of the critical differences that I saw. In the UK, we have lots of equipment. Sometimes things are delayed because of lack of health professionals. So different countries have different issues that they have to try to address. And there's no point in talking about, high-tech interventions, really expensive drugs, if we do not have basic provisions like running clean water in every ward. And I noticed that was lacking in 2011. I hope that has definitely improved since then. I noticed that, things like alcohol gel was lacking, things like bedding for the cots in the pediatric ward, that was lacking. So it would be really, really great if sort of basic provisions were met.
Relief in the battle against COVID-19 came in the form of vaccines. Since December 2020, the United States, the United Kingdom, China, India, Russia, and topping the list, Israel, which has vaccinated over 1 million of its citizens. Nigeria, according to the federal government, should join this list by the end of January. But even before the vaccine is approved in the country, there are divided perceptions on the safety and efficacy.
It is said to provide 94% efficacy. It can prevent disease in 94%. So it means that for every 100 persons who receive the vaccines, we expect that 6 of them will have the virus. We need to recognize that. So if someone receives the vaccine and has the virus, he's among the 6%. And those who don't get the virus because they have the vaccine, they are among the 94%. So we need to recognize that there is a small percentage of persons who will still get the virus even if they receive the vaccine. People are having reactions to vaccines. People have always had reactions to vaccines. Like you rightly pointed out, it was horribly put together. So over time, whatever is maybe causing those reactions, either in the preservative or in whatever component, will be gradually removed.
The chairperson of Health Commissioners Forum, Dr. Etaidu, has worries on the storage, transportation, and preservation system available for the vaccine.
There is only one approved vaccine for now, which is the Pfizer BioNTech. We all know very well the level of rumor and issues around vaccination, misinformation, right information, wrong information, all of this under risk communication pillar. And so there's a lot of work that needs to be done, both at the federal level, at the state level, at the local government level, engagement with key stakeholders, engagement with communities to see that the right information is passed out to the public. A lot of training still needs to happen for health workers all across the country so that they can appreciate the vaccines, the peculiarity of it, sensitivity of it, and how best they can store it and keep it in potent form from the point where they get those vaccines to when it's delivered to the end user. We also have to give them information on those people, the key population that would be receiving, or section of the population that would be receiving these vaccines first before others. Remember, it's 100,000 vaccines that will be coming in at the end of January. But most importantly is the issue around the cold chain system. Definitely we know that at the national level, at the federal level, they have a proper cold chain that should be able to maintain these vaccines in its potent form and store them between -80 to -60 degrees centigrade. However, as these vaccines move from the federal level to the zonal stores, down to the state cold stores, to the local government cold stores, to the wards, to the primary healthcare centers in villages, a lot of challenges exist. The cold chain system has issues in almost all the states in Nigeria, and a lot of support will be needed in that aspect. We need to be able to get all the cold chain equipment that can keep these vaccines in potent form, so it doesn't lead to massive wastage or people receiving vaccines that are not potent and would not give them any form of protection. We know all the issues around the power supply across the country, availability of this cold chain system equipment in primary healthcare facilities and secondary facilities, functionality of these facilities. All of those things are things that should be addressed at this point as we go ahead. Beyond this, of course, for us in Cross River State, we have a peculiar situation that requires even more support from the federal government following the NSAS protests that destroyed and vandalized the state cold store, destroyed and vandalized some health facilities that should even be the first recipients in the states before they're sent down to the local government, the wards, and the primary healthcare facilities. A lot of work needs to be done before these vaccines come in.
Then there's the possible skepticism which may come from trusting that the system means well. The senator representing Benue North promises that the lawmakers would contribute to the process.
I agree with those concerns. Nigeria and indeed Africa should not be a dumping ground for substandard products. I agree with that. But let's not allow that to get in the way of our people getting access to this vaccine. The advanced countries, America, Britain and others, they are giving their people these vaccines. They are yet to come to Africa, meaning that there's something to save for those vaccines. Let's not throw away the baby along with the bathwater. We have to be very serious, but we also have capable scientists in Nigeria who can decipher, who can find out, sift the chaff from the grain.
As a 2021 plan, the Minister of Health had in December 2020 shared the administration's plan to include implementation of mandatory universal health insurance in collaboration with state government and the FCT administration, operationalization of the Basic Health Care Provision Fund in collaboration with partners and agencies, recruitment and deployment of 50,000 community health extension workers, revamping federal teaching hospitals across the country, collaboration with private sector investors to establish high-quality hospitals in Nigeria, reduction of gaps in all health-related SDGs by at least 60%, reduction in the current imbalance between primary, secondary, and tertiary healthcare, active collaboration with the private sector to create a large number of well-paying jobs for Nigerian youths, and contribution to the realization of the President's June 12 promise to take 100 million Nigerians out of poverty in the next 10 years. Well, that's it for this episode of Special Reports. Please remember that saying stay safe is not just a slogan. It actually requires actions such as wearing your face mask in public, washing your hands, and keeping physical distance. See you next time. I'm Ini John Mekwa.